Bonnie Barnes is 50 years old. She lives alone. 2 years ago, she was diagnosed with ovarian cancer. She was treated with surgery and chemotherapy. Lately, she's been having pain.
Hi, this is Lily at the Acorn Clinic. How can I help you?
My oncologist said that I need to get a primary care provider until I go back to her next year. My old provider retired. You taking new patients?
Yes, we are taking new patients. How are you feeling right now?
I feel terrible.
When Bonnie was receiving cancer treatments, she knew who was taking care of her, what she had to do, and where she had to go. Now the treatment is over, Bonnie faces new anxieties. She no longer has a regular routine, she's looking for a new provider, and she's uncertain whether her cancer might come back. She lets Lily know that her cancer is in remission, but she doesn't understand why she isn't feeling better physically and why she still feels anxious.
Both mentally and physically, this is a difficult part of the process. Maybe we can help. I'll need to ask you a few questions so we can better understand your needs.
As an intake specialist, Lily knows that she must help new patients feel at ease and understand that the more information they provide, the better their care can be. What should Lily try to learn from Bonnie during this first encounter? Lily learned that Bonnie had ovarian cancer and has abdominal pains that have forced her to adjust her lifestyle. Lily also finds out that Bonnie's husband died 2 years ago, that Bonnie is no longer working, and that she no longer has health insurance.
Thank you for answering my questions. Though you don't have insurance, we can still help you. I'll mail you a first-time patient packet to fill out. It includes a medical release form that will enable us to get your records from your previous provider.
I'm not so good at filling out forms.
Well, let's schedule some time before your visit to work on them together.
Usually the first and last face a patient sees during an office visit is an office staff member. That's why the office staff's friendly disposition and professional attitude are crucial to the patient's positive healthcare experience. What are some ways that office staff members can make a patient feel welcome and at ease?
Lily said you'd be in today. If you'd like to have a seat, I'll page her and she'll be with you shortly.
Okay, thank you.
With Lily's help, Bonnie will fill out the new patient forms. As Bonnie completed the medical history section, she talked to Lily about her previous pain management. Lily suggested that Bonnie tells the provider about her pain, her fear of the cancer returning, and her living alone.
Hi, Mrs. Barnes. My name is Ranson. I'm going to be your nurse today.
Hi.
How are you doing today?
Good, thank you.
Good. Thank you for filling out that paperwork. It's going to give us a better idea of what's going on with you medically speaking.
Besides taking vitals, nurses play a pivotal role in identifying the pressing needs of the patient and in helping the patient feel at ease with a visit. What are some ways that Ranson the nurse can help Bonnie communicate how she thinks her cancer and its treatments are affecting her now.
Okay, 140 over 80, that's a little high. Are you having any pain right now?
Yes, I'm having pain right here. Pain in my side, my right side, and it started during chemotherapy.
I saw on your chart that you had ovarian cancer. I'm assuming that's what chemotherapy was for.
Yeah.
Have you mentioned it to your oncologist at all?
Yes, and the doctor gave me pain pills for it, but I ran out about 3 weeks ago, and I just can't afford to refill them. But I'm not taking chemo anymore, so I don't understand why it's hurting.
Okay, well, let me go let the doctor know. I'll go ahead and tell her what's going on, and
All
then
right.
she'll be in just in a little bit.
Okay.
Thank you.
Thank you.
According to the American Academy of Family Physicians, the typical family provider has 3 to 4 patients newly diagnosed with cancer each year. As many as 10 to 20% of a primary care provider's patients can have a cancer history. Primary care providers are a vital part of their patient's cancer care team. These providers help with health maintenance needs, preventive care, and oftentimes case management. They're also an information source.
Good morning, Ms. Barnes. I'm Dr. Fagan.
Nice to meet you.
So I hear you're in pain today. What's bothering you?
Before the provider performs an examination, she assesses Bonnie's pain. Providers should first determine if patients have pain to avoid hurting them during exams. Additionally, providers should tell patients what they plan to do before carrying it out. Patients should be kept abreast of the visit's process every step of the way, before, during, and after they see the provider.
I have a pain right here on my right side.
On a scale of 1 to 10, how would you rank it?
I'd say it's about a 6.
Okay, well, we want to work on getting you out of pain. So the pain started after your cancer surgery?
The provider gives Bonnie cues to help her identify the pain. Bonnie lets her know that she feels sharp pain in her abdominal area, especially after prolonged walking or standing. When working with a patient with a cancer history, a provider's first goal should be to rule out whether the patient's pain is cancer-related or not. This requires taking a thorough pain history, and potentially, further tests will need to be ordered. In the meantime, the provider should try to relieve some of the patient's suffering.
Are you feeling pain all day, or does it start at a certain time, or tell me a little bit more about how you're feeling.
It seems to be all the time, and it's hurting right in here. It's like a sharp pain.
And how does it affect you?
It makes grocery shopping really hard, and I find it hard to go to church, and that's where all my friends are.
Bonnie has been under the care of an oncologist who prescribed pain medicines for her. Regardless, negotiating pain management for Bonnie that's appropriate for the primary care setting can still be challenging. The primary goal of pain management in the primary care setting is to improve the patient's ability to perform important daily activities. That includes shopping and socializing.
Now that we understand your pain, let's start your exam.
How was your visit?
Good, thank you.
Good. Here's your bill for today's visit.
Okay, thank you.
If you'll give me a moment, I'll page a pharmacist and she can answer all your questions about your medication.
Thank you.
The pharmacist ensures that Bonnie understands how to take her prescribed medication and what the medication is for. It's best to have patients repeat medication directions back to you and to provide patients with easily accessible written directions and contact information. Patients should be instructed to call the provider or pharmacist with any questions. When a person is diagnosed with cancer, the cure usually focuses on physical remedies such as surgery, radiation, or medication. However, it's important to consider the patient's psychological and social situation during and after cancer treatment. Bonnie told the provider that she's having a difficult time post-treatment. The provider referred her to the clinic's social worker.
I hear the good news is that you're cancer-free,
Yes, it is.
and that's wonderful news. I also know that sometimes even when you're told that you're cancer-free, there are some other things that come up in life that are hard to deal with sometimes. And I'm wondering if you're having anything going on in your life that's tough right now.
Oh, it's been really hard. You know, my husband died 2 years ago, and my son, he lives about an hour away, and he comes and sees me once a week, but I really don't want to burden him.
The social worker knows that Bonnie faces many obstacles to her psychological health, including not having a strong support network. What are some other types of psychosocial issues faced by patients with cancer, especially those living in rural areas? According to a 2007 Institute of Medicine report, obstacles to psychosocial health in patients with cancer include lack of information or poor information management, lack of transportation, disruptions to daily activities, insufficient financial resources, and emotional difficulties such as depression or anxiety. Even years beyond a cancer diagnosis, patients often worry about their cancer recurring.
Well, why don't you consider perhaps coming in to see me maybe once a week for a little while, and we could talk about some of the things that are going on in your life that are troubling you?
I would really like that, yes.
Okay, good.
Yeah.
And also, please bring your son in with you sometimes too, because that could be helpful too for him as for you, okay?
Okay.
Okay, great.
Thank you.
Regardless of your role at the practice, caring for people with cancer boils down to one thing: seeing the patient's comfort and care as your responsibility.